We've all experienced stomach aches, but whether it's dull or mild discomfort or severe cramps, the pain is experienced anywhere between the chest and the pelvic area. Today, we'll talk about two of the more common causes of abdominal pain, which are food poisoning and the stomach flu. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk right here on CNN Philippines. Pain in the abdomen can be caused by many different reasons. Our guest today will help us understand the difference between the stomach flu and food poisoning. I'd like to welcome on the program Dr. Eric Yasay. He's a gastroenterologist and clinical associate professor at the UP-PGH. Also with us is Dr. Christian Francisco. He's an infectious disease specialist and a fellow at the Philippine College of Physicians. Thank you, doctors, for being with us. Now, we want to start with stomach flu muna, or what is known as viral gastroenteritis. And as the name implies, it's caused by a virus. Dr. Eric, help our viewers understand what exactly causes it.
So stomach flu is not caused by the influenza virus, but it's caused by two different viruses. So namely the rotavirus, which is more common for the children, and the norovirus, which is more common in adults, so sa mas matatanda siya. No, so usually also, there is a pattern to which we attribute the stomach flu that is characteristic of the illness. So usually may incubation period siya, like our other viruses. So that would mean after eating, it would take some time, usually within 24 to 48 hours before your illness starts.
Okay, very good. Now, Dr. Christian, madali ba makuha itong dalawa? Stomach flu, food poisoning? Dito ba sa Philippine setting natin, anong mas common or mas madalas nyo makita?
Usually, yung mga nakikita natin na stomach flu and food poisoning, more common pa rin yung mga stomach flu or yung ating viral gastroenteritis. Usually, both of them, no, nakukuha siya through ingestion of contaminated water or food. Sa atin pa rin, sa setting pa rin natin, most common pa rin talaga yung mga viral gastroenteritis.
Okay, so contaminated food and water are among the causes of the stomach flu. And it is actually contagious dahil nga virus ito, through close contact, pwede kang mahawa. Symptoms can appear anywhere from day 1 up to day 3 after exposure to the virus. Katulad sinabi ng mga experts natin, may incubation period dito, no? Dr. Christian, could you take us through some of the symptoms during this incubation page? Anong bang mas common na mararamdaman ng ating mga viewers kapag meron silang stomach flu?
For the stomach flu, no, ang common na mga symptoms dyan, ang nararamdaman ng mga pasyente natin, is they have watery diarrhea. This is usually accompanied by crampy abdominal pains, no? Yung humihilab yung tiyan, no? Madalas na paghilab ng tiyan. And then like a common viral infection, they can have body malaise o pananakit ng katawan and fever. So yan yung mga common na simptomas ng viral gastroenteritis or what we call stomach flu.
Okay, so diarrhea, pati ng pagsusuka or vomiting are some of the most common symptoms. And I wanted to put it out there that all of these symptoms will actually cause dehydration. Dr. Eric, how do we manage this? Especially if hindi naman makontrol ng pasyente ang pagpunta sa banyo o yung pagsusuka nila. How do we manage the possible dehydration na mangyari?
Well, yes, very important yan. No? So number one, we have to know first if the patient can tolerate replacing his or her fluid losses. So ibig sabihin, kung nagsusuka yung pasyente incessantly, hindi tumitigil yung pagsusuka, that's very difficult to manage. So if the patient naman doesn't have vomiting as a major symptom and can tolerate trying to replace his or her fluid losses, then the patient can just take fluids which are rich in electrolytes, like our oral rehydration salts. No, so very important yun. So usually I advise my patients to estimate 1:1 how much they lost and try to replace it with oral rehydration salts. Yan yung Oresol, no, na nasikat yan sa mga centers natin in the pharmacies. No? But if the patient cannot tolerate eating or has very worrisome vomiting or suka ng suka, usually we have the patient go to a hospital to put in an IV line to manage the fluid losses and to avoid dehydration.
Okay, very good. So, another tip, iwasan kapag nagre-replenish kayo ng fluids niyo, iwasan mga liquids katulad ng kape o yung mga mataas ang caffeine content because these can affect not just your rest, but these can actually make you even lose more water. So, also avoid alcoholic beverages which also act as a diuretic. Hindi ito makakatulong sa inyo. Anyway, if you can't keep anything down for 24 hours, you need to call your doctor. Dr. Eric, what else does a patient need to watch out for that should prompt him or her to reach out to a medical practitioner? Dapat nang makita siya ng isang doktor.
Another sign that a patient needs to see a doctor would be fever that cannot be managed by paracetamol or anti-febrile medication. So of course, if the patient also develops bloody stool, so kapag dumudumi ng may dugo ang pasyente, it's also a sign that the infection or the problem is progressing and the patient needs to go to the hospital. And then of course, for certain groups of patients, so yung mga pasyente nating mas mababa yung panlaban sa infection or what we call the immunocompromised patients, like the patients who are undergoing chemotherapy or the patients who have innately lower immune systems, yan kailangan yan magpunta sa hospital to seek medical attention because they might need further medical management.
And there are many ways to prevent stomach flu as well. So we'll talk about lifestyle, home remedies, and more. We're your partner in healthcare here on the program, and we'll be back after a short break. You're watching MedTalk Health Talk right here on CNN Philippines. I'm Dr. Freddy Gomez, and we're together in health here on MedTalk Health Talk. It's difficult on anyone who experiences the stomach flu, and the symptoms can be overwhelming from the aches and pains to diarrhea as well as vomiting. But there are a number of ways to avoid this viral infection. How exactly does good personal hygiene help prevent the stomach flu? Madalas nating marinig, lalo na ngayon, ang frequent hand washing. Dr. Christian, explain natin sa mga viewers natin dito sa MedTalk kung gaano kahalaga ang madalas na paghugas ng kamay.
For viral gastroenteritis, it is very important because you also prevent for other people to get the infection. Kaya lang, kailangan din nating sabihan yung ating mga pasyente. Proper hand washing should be with soap and water and should last 20 seconds or more, para lahat ng surfaces ng kamay natin ay nasasabon ng mabuti. Kung hindi available yung sabon at tubig, kailangan nating gumamit ng mga alcohol-based hand rub, para malinis natin yung mga kamay natin. Important din, aside from hand washing, kailangan din nililinis natin yung mga frequently touched areas o yung mga hard surfaces. Kailangan isa-sanitize natin to kasi kapag nahawakan din yun ng mga tao at for example, nalagay natin sa bibig natin yung mga kamay natin na madumi or infected, pwede rin tayong magkaroon ng viral gastroenteritis. For the kids, importante na mababakunahan natin yung mga little kids natin with rotavirus vaccine, which is also available in our country.
What should our viewers know when it comes to food handling or kung saan nila nakukuha yung pagkain nila to prevent the stomach flu or food poisoning?
Make sure that the food that we bought is clean, nasa malinis siyang lalagyan, and we can reheat it, the right temperature para mamatay yung mga viruses. Although ang problem lang, for example, for food poisoning, there are some bacteria, that can still survive, kahit mataas ang temperature, and may mga toxins kasi na pinoproduce. So the best pa rin talaga na we prepare our own food. And when we are also traveling, kailangan maging cautious din tayo sa pagpili ng mga pagkain natin. Don't drink yung mga water kung hindi sila in a bottle or hindi natin alam yung source nito. avoid eating raw food. For example, we're going to different areas na common yung mga sushi, sashimi. So as much as possible, we want to avoid that.
Now, there are many types of food poisoning, but let's talk about the more common ones. Salmonella is one, actually. Dr. Eric, please explain to us how, when, and where this bacteria develops in food.
So salmonella is very common in poultry. No, so if you have if you eat improperly cooked chicken o kaya raw egg, pwede nating makuha yung salmonella na yan. Particularly, raw meat is the major source of salmonella, and because of the preformed toxins of the bacteria, they cause food poisoning several hours after ingestion as compared to stomach flu that usually may incubation period nga.
Okay, very good. Now, Dr. Christian, yung tinatawag naman na E. coli, saan ba ito nanggagaling para malaman ng mga viewers natin kung paano ito maiwasan?
So usually, E. coli, nakukuha din yan sa mga contaminated food, raw food. No? There are different kinds of E. coli and different presentation. So most of the E. coli infection can cause bloody diarrhea. So important pa rin na properly cook yung mga pagkain natin. So mas maganda pa rin na properly cook and consume it immediately.
Dr. Eric, ngayon na nagkaroon let's say for example, ng stomach flu or ng food poisoning ang isang tao, ano na ngayon ang dapat nilang kainin para mas maganda sa tiyan nila, para mas mabilis yung pag-heal nito?
Okay, so magandang tanong yan, no? Kasi syempre, usually takot kumain yung mga pasyente nating nagkakaroon ng abdominal pains, no? But the advice is that whatever you can tolerate is probably good for you. What you need just to do is to replace your losses. Pero there's advice also of easily digestible food, no? So example dyan yung soft diet, no? So soft diet, lugaw, congee, no? Important yan because madali yang i-tolerate. Hindi kailangan nguyain ng maigi at ma-digest siya ng mas mabilis sa katawan. We sometimes also try to have our patients avoid dairy products kasi ang dairy, pagka dinigest natin yan, mahangin. So kaya makakadagdag dun sa crampy abdominal pain. So you can avoid lactose or dairy products during the course of illness. And then whatever you can tolerate, spicy food, iwasan muna kasi that's also oily. And oily food or fried foods, that's also oily because those foods are difficult to digest. So any food that you can tolerate is probably good for you, but you have to know your own tolerance.
Dr. Eric, isa sa mga simptomas na binanggit ni Dr. Christian kanina na pwede mangyari ay ang bloody diarrhea or may dugo sa dumi. Now, this can be very concerning to a lot of people. Blood seen anywhere. What should someone do kapag meron na silang nakitang dugo sa kanilang dumi?
Blood in the stools is actually a sign that the disease is progressing. So usually kapag may ganyan, dapat pumunta na tayo sa doctor para matest natin yung stools, tapos para ma-start tayo ng antibiotics because usually bloody diarrhea are caused by more aggressive organisms or yung mga organisms na kumakain dun sa bituka natin. No? Talagang kailangan na siyang pagtuunan ng pansin.
Yes, so kapag meron kayong naramdaman na simptomas na ganyan, huwag na kayong maghintay or huwag nyo nang hintayin mawala pa-check na po kayo kaagad sa doktor. So, symptoms of food poisoning are quite similar actually to those of the stomach flu. From katulad ng sinabi, diarrhea, vomiting, loss of appetite, aches and pains. So, when these symptoms persist, this is when you should seek medical advice, especially when you recognize blood in your stool or your urine. When we return, let's discuss how food poisoning is treated and prevented. More after this very short break. Your health comes first here on the program. Keep it here on CNN Philippines. We care about the growing needs of our community. You're watching MedTalk Health Talk right here on CNN Philippines. When germs that cause food poisoning get into our system, they can release toxins or poisonous substances. You mentioned kanina na kapag isang tao ay nagkaroon ng food poisoning or stomach flu, napaka-importante na hindi sila mag-self-medicate at dapat magpa-check sa doktor para tama nga naman ang kanilang diagnosis. Anong itsura ng treatment plan ng isang doktor na with a diagnosis of either stomach flu or food poisoning?
For us na mga infectious disease doctor, no, we have different considerations for those types of diarrhea, ng mga bloody diarrhea. So hindi lang yan iisang organism. So kailangan namin yung history, no, yung clinical presentation ng pasyente para magabayan kami kung ano ba yung mga test na ipapagawa namin. So kung yung mga bloody diarrhea, usually nagre-request kami ng stool culture o kumbaga kinu-culture namin yung dumi ng mga pasyente para malaman namin kung anong klaseng bacteria yung mama sa kanila. Para malaman din namin yung pinaka-the best treatment for them.
Dr. Christian, itong klaseng condition ba na-diagnose na ng tama yung pasyente, is this something na pwedeng i-manage ng pasyente sa bahay nila or dapat close monitoring sila sa ospital? Because alam natin ngayon, marami talagang takot na pumunta ng ospital or ma-admit sa ospital because of the pandemic.
Hindi kasi yan sa clinical presentation ng pasyente. So kung ang pasyente naman ay stable, no, ibig sabihin walang pagbagsak ng blood pressure, nakakakain naman sila, no, pwede tayo mag-prescribe ng oral antibiotics na pwede nilang inumin sa bahay. So, nagkakaroon lang o nagiging iba ang usapan kapag ang pasyente ay may mga senyales na medyo delikado siya. For example, bumabagsak ang blood pressure niya, patuloy ang paglalagnat, o yung pagdudugo sa dumi ay tuloy-tuloy na hindi humihinto. Yan yung mga kailangan na ma-admit sa ospital.
Now, Dr. Eric, something like this, stomach flu or food poisoning, may be a way for anyone who experiences it to gain the importance of having their gastrointestinal system checked.
Number one, yung stomach flu at food poisoning should be self-resolving. So ibig sabihin, kung hindi malala, no, kagaya nung sinabi ni Dr. Francisco, dapat kusa itong mawawala, no, within 5 to 7 days. No? But if the symptoms persist, no, despite the intake of antibiotics, and usually if the symptoms persist for more than 2 weeks, then that's a good time to go to your gastroenterologist. No? Especially if you are at an age that you are prone to conditions that cause bleeding of the GI tract. Kagaya kapag ikaw ay mahigit 50 anyos na, then that's a good time to consult your gastroenterologist and probably look for other causes of the bleeding like a polyp or a mass in the colon. No? So yan yung dinidescribe natin na patients that are candidates to undergo colonoscopy, no? Yung pagtingin ng bituka using a camera. So yun yung dapat tatandaan ng patients natin. Food poisoning or stomach flu are usually self-resolving if they are mild. No, parang sa ubot sipon lang din na kusang mawawala. But if they are more severe or moderate to severe that needs antibiotics, if they persist for more than 7 to 14 days, they need to consult a gastroenterologist to look for other sources of bleeding.
Is there a certain age that you would recommend patients to have a regular colonoscopy done?
We begin to do screening for colon cancer. Yan po ay good advice. No? Ibig sabihin po ng screening kahit walang nararamdaman. You are a candidate just as long as you qualify by age. No? Pagkasampa natin ng 50, pwede na tayong magpa-colonoscopy. And there are different ways to screen for colon cancer, not just colonoscopy. We can also do what we call fecal occult blood test or the fecal immunochemical test. Nagde-detect po ito ng dugo sa dumi na microscopic, no, that cannot be seen by the naked eye, no. So tinitingnan sa microscope yung ating dumi. Kapag may dugo, then you are a candidate for colonoscopy. So yan po ay nagsisimula at the age of 50, and this is good advice for any healthy person as long as you're 50 and above.
Marami talaga tayong natutunan sa ating mga guests today. And with that, I'd like to thank them, gastroenterologist Dr. Eric Yasay and infectious disease specialist Dr. Christian Francisco. We appreciate your time. Maraming salamat for the very thorough discussion that we had here on MedTalk Health Talk. I'm Dr. Freddy Gomez. Thank you for watching. Stay safe, everyone.